Hello, good evening. Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Today is the third day of May 2022, and today is actually our first clinic in the month of May. And we're going to talk about pregnancy any which way. Like, what are those things you can actually apply practically, and you will increase your chance of becoming pregnant in the month of May? May is 31 days and we've already spent 3 days. So the question is, how ready, how practically ready, how proactive do you have the basic tools that will help you to become pregnant in the month of May? Do you understand that if you apply all these tools together with your prayer, together with your practicing, together with your praying, you will be on your way towards becoming pregnant in the month of May? Now, you will never have May again. So it's important we maximize our chance, our potentials of becoming pregnant in the month of May. So when you join, just give me a few minutes. I'm going to explain. Then you have opportunity to ask your questions. My points are going to be pretty simple. They are pretty much what you hear from me every day. Now, ideally, most couples that want to become pregnant, if they are younger than 35, if they make love consistently, they will become pregnant within 1 year. About 89% of couples that make love regularly will become pregnant within 1 year of doing it regularly. So it's not like, oh, 1 month you do it, then the other month you're tired. You have to be persistent. Now, becoming pregnant, it's an individual thing. Some people will just want to become pregnant, just one more lovemaking, they can become pregnant. So some women can easily become pregnant, whereas some other women might take some time to become pregnant. But guess what? The common denominator is that at the end of the day, every woman will achieve pregnancy or achieve motherhood. The question is, how are you going to get results? Not every woman will do it the right way. Some women will need help. Some women will need drugs. Some women will need IVF. Some women will need IUI. So what we're going to do this evening is to look at those practical things we can individually do to improve our chances. So what's number one? By default, you should notice regular love making. Regular love making will get you pregnant. Globally, the highest pregnancy rate is seen in couples that make love every other day. That's where you have the highest pregnancy rate globally in all cultures, in all economic strata, anywhere you go. Couples that make love more will become pregnant faster globally every other day. Some couples might prefer making love every day, whichever one that works for you. The number one practical tip is to use the freest, less expensive tool, your body, both of you. You should understand this by now. You cannot do magic, especially if you are younger than 35. If you can make love round the corner, the possibility is that from January to December, you would have released 12 eggs. Now, if you have availability of quality sperm, so the key word is what? Quality sperm. There is absolutely no way, at least within 12 months, you won't become pregnant. If every other factor is taken care of. Unfortunately, not every other factor will be taken care of. So number one tip still remains your love making. Make love around the corner. Now understand the impact of love making when you are above 35. So if we were to do a comparative analysis between women that are younger than 35 and women that are older than 35, which group do you think needs to make love more? Women above 35. Now, if we ask another question, between below 35 and above 35, which group do you think will have more interest in making love? Below 35. Why? Because as you're getting to that 35, there are so many changes that happen in your body. You're stressed, you're not happy, your hormones are fluctuating, your estrogen is down, your libido is down, you're having dry vagina. So you might not really be keen to make love. But guess what? Who needs to make love more? Women above 35. Why? Because at that age, you have a disadvantage naturally because the number and the quality of your eggs are gradually depreciating. So you need to increase more when you are older than 35. Now, are you going to have hot flushes, dryness, lack of libido? They will come. Are they supposed to stop you? No. If you have to have a timetable, have a timetable. But please, by any means necessary, anytime, please make love. In the month of May, please go and have timetable. Please. Matter of fact, some women are complaining, oh, doc, I have not seen my period. Guess what? In the month of May, if you have not seen your period, it's an advantage. So all the women in our group right now, if you are hearing my voice, if you are not seeing your period, it's an advantage. Keep on making love. So long as you have not gone into menopause and you are not bleeding. Bleeding is not equivalent to becoming pregnant. Some women might not bleed, but they are ovulating. So if you are not bleeding in the month of May, it's an advantage. So let's do the mathematics. We have 31 days in May, right? If you didn't bleed in May at all, if you do it every other day, at least in the month of May, out of the 31 days, make love at least 15 times. If you can do this, and God be God, if you are gonna release your egg in the month of May, which can come like a thief in the night, even when you think you can predict your cycle, your eggs can play tricks on you. You might have a broken relationship. You might be into sports. You might not sleep. You might stay up late night gossiping and touching base with your friends, and your hormones will flip. You might be waiting for it tomorrow, and it might come 2 days ago, or it might come 2 days after. So we don't care when it's coming. What we care is that you're making love. Do you understand the logic? You have to make love from the first day of May to the last day of May, so long as you're not bleeding. Now, some women will also want to make love when they are bleeding. So long as you and your partner are on the same page, if you want to make love when you're bleeding, it's completely okay, medically okay. You know, so I know some people will be like, but doc, there is blood, and what about infection? Guess what? Whether there is blood or whether there is no blood, once there is contact between the penis and the vagina, and any of you harbored an infection, you can easily transfer it over to your partner. So whether you're bleeding or not bleeding and you have any infection, you can cross-transmit each other. So it's all about social desirability. It's all about what you need to do. So my biggest tool in this group, which if you follow me, one of my best, phrases, Obago. Obago is Igbo language of it has happened. That means you've missed your period, you're pregnant. If you can follow me religiously in the month of May, and if you can make your motto love making every other day, if you can make love every day, that's okay. Look, my people, this is practical. You have been praying, you have been fasting, you have been staying up, you have been telling the whole community, it's time to room in. If you are in the guest room, move back to your major room and make love. It works. Women that make love can easily become pregnant at any age. The same thing is applicable to men. Some men might have low sperm count and they become so demoralized. Oh, the doctor told me my sperm is low. Guess what? Even with your low sperm count, if you improve and if you increase the frequency of your lovemaking, possibility will be that the low sperm count can still get the woman pregnant. In male fertility, we don't just look at the count, we look at the motility. Okay, if you have this low sperm count, assuming you ejaculate quality sperm, can it get to the womb? Can it get to the tubes? If it can meander to the womb, to the tube, one quality sperm can fertilize one egg, and you can even have multiple pregnancies. So don't rule yourself out until the game is over. Until we get to 31st May 2022, don't tap out. The game is not over. The game is only over when you lose hope. Now, the day you might not feel like making love might be the day you will become pregnant. There are so many women that are currently quarreling with their partner. You know yourselves. You are quarreling as I'm talking to you. For nonsense. This might be the day you become pregnant. And when you miss it, you begin from ground zero in June. And you only have one opportunity to become pregnant in June. One. 24 hours. Because once your egg is released, and if you don't fertilize that egg, you have lost that opportunity. This is why we preach regular lovemaking. Because at any point in time, we have fresh sperm in the vagina waiting for the eggs to show up. Some eggs can grudgingly show up by 2 a.m., 1 a.m., 3 a.m. Your partner might be snoring. You might be waiting for your partner to make love to you again because you feel it might be the next day. But your eggs can only last for 24 hours. So please, number one, increase the frequency of your lovemaking. If it's painful, get a sperm-friendly lubricant. But by any means necessary, make love. You can buy it. It's very cheap. You can pay for it. It's there for you. You don't need any special thing. Whether there is NEPA or no NEPA, just make love, my people. Very important. Every other day. Now, you have to work on your body weight. There are so many of our members, so many women. Oh, doc, I really want to be a mother. I've been doing this, I've been doing that. Then I ask them about their BMI. They are 35. My sister, what are you doing with 35 body mass index? You don't need to be in the 30s. You don't even need to be in the upper 20s. You need to be between 25.5 to 18.5. So please, for the month of May, evaluate your BMI. If you are not doing the right things, start doing the right things that will place you on the right body weight. We don't want you to be low weight. Some women do not have fats in their body. Some women are only bones. You cannot become a mother with only bones. We need those fats. So work yourself up to the healthy BMI. Your healthy BMI is 18.5 to 25.5. If you can find yourself there, that's okay. I don't want you below. Matter of fact, when you compare women that are underweight with overweight and obesity, women that are underweight will find it more difficult to become pregnant. Women that are overweight can even become pregnant. Some of them might even have twins. But when you begin to get to that obesity range, you are not going to help yourself. So work on your body weight. How can you work on your body weight? Watch what enters your mouth. Life is garbage in, garbage out. Eat cleaner. Move your body 30 minutes every day. Just do something. Dance, go for walk, do something. You guys saw me doing planks, going for walk, doing this, doing that. I'm a man, so it doesn't matter if you're a man. Just move your body. Work on your body weight. The same thing is applicable to the men. You have to watch your body weight. Okay? Now, the next thing, please pick your phone and get a good doctor. If you are not already subscribed in this group, May might be your only chance of getting in before the changes will happen in June. So get a doctor. Book a preconception appointment. You see, you need a baseline. Some women do not have baseline. I don't know about your hormones. I don't know if your tubes are open. I don't know if your ovaries are okay, but you want to become pregnant. You need to go for preconception visit. Preconception visit means both of you will present to a gynecologist. And we are going to check the woman from head to toe. We're going to check the man from head to toe so we can have a baseline. When we have a baseline, then I begin to tell you what you need. Then during that visit, I also advise you on a couple of things you need to do to modify your lifestyle. Very important. So many women have not seen their doctors for the past 10 years. We don't know where the problem is. Now, imagine yourself, you want to become pregnant, right? But you have poor ovarian result, or you don't even have eggs, but you didn't know you didn't have eggs. Imagine yourself wanting to become pregnant, but your tubes are blocked, but you didn't know that your tubes are blocked because you haven't gone for checks. So preconception visit is very, very important. Now, when you've done the regular lovemaking by knowing everything about your body, you should know your cycle, you should know when you're likely ovulating. This is just for the academics. Whether you know you're ovulating or not, whether you know your cycle, it doesn't matter. Whether you're bleeding or not, just make love. Whether you're seeing the fetal mucus, it doesn't matter. Fetal mucus does not predict pregnancy 100%. Some women will even seemingly be dry, but they're ovulating. So don't just depend on things you're seeing. Keep on doing your own part. Now, you need to modify your lifestyle. There are a couple of things you're doing, you're not doing rightly. So many women are not sleeping. Sleep will deprive you of becoming pregnant. You can't stay up late night, crying, feeling down. Your hormones are also going to cry. Your hormones are also going to be filled down. So you need to sleep. Sleep is very important. Now, you don't have any business with smoke now. Some of you might not be smoking secondarily. Some of you might be smoking secondarily. Some of you will not light the cigarette to smoke, but your partner is smoking. Your friends are smoking. Your dad, people around you, they are smoking. When you hang around people that smoke, they can damage your ovaries. They can damage your eggs. They can damage a lot of your chances of becoming pregnant. So avoid smoke. Either you move away from them or they move away from you. Both primary and secondary smoke, you have to avoid them as if your life depends on it. Because guess what? Your happiness depends on you becoming pregnant in 2022. Now you need to stop your alcohol, my people. Look, be very firm on this. This is an area that so many men are not listening. Your sperm count is oligospermia or azoospermia. But you are gulping the whole alcohol in the community. You are not helping yourself. And guess what? Most times when you're smoking, you're drinking. Most times when you're drinking, you're smoking. When you're smoking and drinking, what's the next? You begin to eat all those food that contains high cholesterol. When you begin to have all those high cholesterol, what will happen? They begin to collect and clog your arteries, predisposing you to heart problems, and you might actually develop hypertension, diabetes, and you can actually have problems or complications, or you can collapse and die. And they begin to blame the people in the village. So everything adds up. So avoid your alcohol for now. Come on, look, let me tell you the truth. You can drink all the alcohol in the world by the time your baby comes. You see that baby shower. If you want, go and drench yourself in alcohol. It's approved by me. But for now, suspend alcohol. Look, I'm not telling you to reduce it. I'm telling you to suspend it. Suspend, stop, S-T-O-P, stop for now. My people, we are talking about becoming pregnant. It's a proactive thing. You have to trade off something. You cannot present reluctantly and you become pregnant. No longer in 2022. So banish alcohol from your environment. Your beverages, your drinks, and every other thing that contains alcohol. Please stop. I know it might be difficult for some people, but please, if you can do this, you are getting closer to becoming a mother, becoming a father. Now, I know some of you love your caffeine, do your coffee, you do your tea and all that. Be careful. In as much as we noticed that no scientific evidence will connect caffeine directly with infertility, but somehow, somewhere, somehow, they are not helping you. So please also avoid excessive caffeine. Personally, if you ask me, adopt your tea. I've stopped drinking coffee. I'm now a tea drinker and I'm loving it. Now, when you are looking towards reducing your body weight so that your BMI will be within the normal range, be careful. When you go to the gym, don't over-exercise. Don't be a gym rat. When you go to the gym and you begin to jump up and down like a monkey and all that, guess what? You might actually flip your cycle. So many women that exercise excessively will have problems with their cycle. They will discover that they will no longer ovulate. This is the reason, if you pay attention, so many women into sports, you won't hear they became pregnant until they retire or maybe they resigned and they become pregnant immediately. Why? Because when you're into active sports, your body is so confused, your hormones are so confused, you will notice you will not even ovulate. If you ask yourself a simple question, whenever you're stressing, what happens to your cycle? They are all over the place. Whenever you're taking your Clomid and you're taking your antibiotics or you're taking your anti-malaria without your doctor's prescription, pay attention to your body. Your body will be giving you signals that something is wrong. Now, when you go for your preconception visit, make sure we review all your medications. You see, there are some medications that will stop you from becoming pregnant. There are some drugs, there are some herbs that might contain some hormones that will stop you from becoming pregnant. So many women are taking Clomid without prescription. You are not helping yourself because some people might not have a need for Clomid. Then you're taking Clomid. What are you doing? You're now punishing your ovaries. You're altering the whole balance. Avoid it. Make it a point of duty to have a doctor you can report to, a doctor that will tell you to do this or the medications. Let your doctor make sure everything is good. Now, be conversant with your body. If you are below 35 and you know you have a regular cycle, then pay attention to the likely period you are ovulating. If you're below 35 and your period and your cycle fluctuates between 20 to 35 days, you can apply factor 14. Then you know exactly or just approximately that this is about the time I will likely be ovulating. So that if something happens, if your partner is giving you a day to come back, then the best time, if you're below 35, to tell your partner to come back should be about that time you are ovulating. But if you guys are not living together, if your partner is in America, you're in Nigeria, and you know that your partner will be in America for the next 10 years, and you know you're 45, don't allow your partner go back. Let's collect his sperm, keep it in a sperm bank, so we can use it to continue trying. You should not be apart from each other for a long time, because for every single year you're not pregnant, you're losing something. Talk to your doctor as soon as possible. Below 35, 12 months. After 12 months, talk to your doctor. Above 35, 6 months. After 6 months, talk to your doctor. In your 40s, talk to your doctor immediately. The older you are as a woman, the more the need to talk to your doctor immediately, so that we can begin to see what we can do for you. Because a woman is like a flower. You blink, it's all over. And it's not a disease. Menopause is not a disease. It's a transition, just like pregnancy. Pregnancy is not a disease. Pregnancy is a blessing, but it comes with a lot of changes. The same thing is applicable to your menopause. Every woman is going to go through that. Okay, so that's my presentation this evening. I'm going to allow you to ask your questions right about now. So the clinic is open. Please feel free to ask your questions so I can provide you feedbacks. Remember, if today is the first day attending our clinic, my name is Dr. Chudi. This is our channel. We come in every Tuesdays about this time. Then on weekends, we come in a little bit earlier, 12 p.m. But if you haven't subscribed, please take a moment, click on the subscription button, share it with the community. Now we have a special community. We have a special pack. So you can join in an exclusive community where you can have more close interaction with me. If you desire that, click on the join button, then select the one that is applicable to you. What I believe is this. There is nobody in my community, I don't care where you live, who is born barren. We are all mothers. We are all fathers. So I'm challenging you today. If you are watching me and you've been crying and you've been wondering, will I ever become a mother? Are you kidding me? You're a mother. It's a matter of time. But right now, please ask your questions so I can provide you feedbacks. Okay, my amazing COO is already in the house. How can one with PCOS normalize their BMI to enhance conception? It still boils down to lifestyle modification. The problem with polycystic ovarian syndrome is the fact that ultimately you will not ovulate because you have had hormone imbalance. So your hormones are all over the place. The hormones that ordinarily should help you to ovulate, they are not within the normal range. You are producing more male-dominated hormones, which will suppress your ability to ovulate. And when that happens, you will not ovulate. And when you don't ovulate, you will not become pregnant. So one of the things you can do if you have polycystic ovarian syndrome and you're looking towards becoming pregnant is to modify your lifestyle. You have to exercise. You don't have any other option. So exercise, eating good, avoiding your alcohol, avoiding stress. If you can bring your body weight within normal range by modification, some people can come down from 300 pounds to 150 pounds simply by modification. Taking charge of your food, taking charge of your 24 hours, making sure you're eating properly, making sure you're avoiding your alcohol, making sure you're drinking your water, and making sure you're sleeping. Sleep is very important. If you can modify your lifestyle and your BMI is within the normal range, even with your polycystic ovarian syndrome, you can become pregnant. Now, together with your modified lifestyle, we can give you Clomid, we can give you metformin. These are the two major drugs we normally use in managing polycystic ovarian syndrome. Okay, keep asking your questions, please. It's difficult dealing with diagnosis of unexplained infertility. Correct. What's the way forward when frequent lovemaking is not working? Now, what I tell my clients is to, those days you don't feel like it's actually the days you might have an opportunity. Now, unfortunately, in some couples, we check the man 100%, we check the woman 100%, but you guys are still not able to become pregnant. This is when you need to hunker down and begin to look for help. When you have unexplained infertility, it means that the woman is okay, the man is okay, but still, despite regular lovemaking, you are not able to become pregnant. When you find yourself in this unending pendulous, merry-go-round, you need a fertility specialist. So how we normally attend to people that have unexplained infertility is to have a baseline. Then we check and see if the woman is ovulating. Ovulation is at the center of everything. If the woman is ovulating, we can target IUI with your natural ovulation. So we collect the sperm. We are trying to help the penis. We collect the sperm. Then we target where you are ovulating. Then we use intrauterine insemination to see if we can achieve pregnancy by ourselves. If that doesn't happen, then we can give the woman ovulation induction drugs. That means we can go for IUI with ovulation induction drugs. If that fails, then we graduate to IVF. So eventually, couples that have unexplained infertility might end up needing IVF. IVF is the ultimate. So, but please, don't tell us, oh, doc, everything is okay. They told me it's okay, but for the past 12 years, we still don't have a baby. That's not right. If you have tried, and we don't even like using the word try, if you have believed God, and after 12 months, everybody, 12 months, everybody, and you don't have positive pregnancy test, and they told you everything is okay, then you have unexplained infertility. You cannot wait for 12 years. Do you know what 12 years means? You can't wait for 12 years. Then by the time you're coming, it's late. No, you have to begin immediately. So everybody in my community having unexplained infertility, you need a fertility specialist. A fertility specialist is a doctor that went to medical school, had his general MBBS certificate, went for specialty, specialized in women issues, then now decided that the only area in women's health he or she will be interested in is in helping people that have infertility. Is a specialist. And that's what you need. You need one. Infertility is a temporal challenge. Pregnancy is a permanent blessing. You will have challenges, but you overcome your challenges. And you need help. Okay? All right. Good evening. Which tea is good for someone expecting? You can have your green tea. Green tea is okay. You can have other tea, but please be mindful of the caffeine content. So green tea is okay. All right? Pretty good. You can do your green tea. Okay? Guys, please keep asking your questions. Ask your questions. I've finished my presentation. We talked about the steps, the practical steps you can take to achieve pregnancy in May. And what's the central point? Lovemaking. Just go home and make love. Okay? The cost of IVF is much. Is there no ways doctors in Nigeria can help low-income couples at least? Now, my sister Chinyere, here's the deal. There are so many things that are very expensive globally. So many. Now, I remember growing up. I remember there are so many things I wanted in life. And somehow my parents were civil servants. And somehow, I always have a way of getting what I want. Somehow. I think outside the box. How do I do that? Sometimes you might have extended family here and there, or during festive period, previously you can go to all your relatives and they will do balloon Christmas and all that. Then you save it. And sometimes I will do something to gain little things. So it's all about thinking outside the box. I understand IVF is expensive, but guess what? What's on the other end? Your kids. So you cannot, because you don't have money, now relax. No, you have to find a way. If you need to downgrade. If you need to go to people we call social capital, your friends, your church, your congregation, your relatives, people that care about you, they can rally around you and raise that money. You can even borrow. You cannot use your babies as collateral. So why am I saying this? Globally, the economy is hurting. So you might not be the only person that is really finding it difficult. There are some people that don't have access to internet. There are some people that don't have access to YouTube. There are some people that don't have access to Facebook, but they still have challenges. So I believe that at any point in time, we have an advantage. So please don't be in lack of money and you are in your comfort zone and you're not doing something. Think outside the box. Anybody that genuinely loves you and cares for you should rally around you. It might be your church. It might be your pastor. It might be your workplace. It might be your mom. It might be your dad. It might be your uncle. It might be your siblings. When they ask you, oh, what's going on? Tell them what's going on. Don't be too proud to ask for help. But by any means, get help. Because guess what? If you need IVF, going for IVF will not guarantee you pregnancy. So it's not like, oh, once you go for IVF, automatically it will become pregnant. No, sometimes it will fail. Sometimes it will succeed. So what you need to do is actually step one. But not doing something is not acceptable. You have to do something. Very, very important. Okay? Stress of infertility affects libido 100%. How do you reconcile this with required frequent lovemaking? Now, this is your moment of truth, right? Personally, when I want something, I don't care what's standing on my way. So I understand the stress, which can come from the man, which can come from the woman. And it's very tough when you're dealing with issues of psychology, when you're dealing with issues of hormones, when you're dealing with issues of emotion. So I can tell you, oh, do this, do that. But when you go to die your bed, you are facing your world. Excuse me, you're the only person there, you're crying, your partner is looking for other avenues to fill in that gaps. Probably he's drinking, he's looking for other places to get, kind of comfort. Then that's the time you need to be careful. You need to talk to each other. You need to seek help, professional help. You can even talk to your general practitioner and we can talk you out. Sometimes talk therapy can help. But you need to take calculated, intentional steps to still keep making love, even when your libido is down. Let me tell you, life is not going to get easy. Life is always going to get stressful. So even when you don't have libido in 2022, in 2023, it might get worse. So you have to learn how to live with all these challenges, but you have to also remember where you're going. What are those big things you're looking at? Okay, if you have low libido now, have you looked beyond the low libido? The days you're supposed to make love, are you going to make love despite the fact you don't have low libido? Yes. How do you do that? By doing it. By being on the same page, by talking to each other. Because there is never a time that both couples will be on the same page. The day you might have libido, your partner might not have libido. The day you're happy, your partner might not be happy. But you need to form a bond so that both of you will understand that you're going in the same direction. Unfortunately, in most relationships, people are in their different comfort zone, approaching things differently. The woman is feeling that the problem is coming from the man. The man is looking for another woman to, give birth to, his baby. So that's not right. So we understand that libido will be affected by the stress. We understand that it can happen. But the question is, what are you going to do about it? If you know that when you make love more, you have your baby, will anything stand in your way? No. If the penis is not rising, you go and get help and make sure that the penis rises. At that particular time is war. You've declared war against infertility. So anything standing in your way, you get it. I remember when we were in secondary school, when we were, making our choices. Oh, what do you want to be in life? Are you going to be a doctor? And if you want to be a doctor, you're going to take jump, you're going to do this, you're going to get this subject. It was tough, but we stayed late nights and we went to write exams and did all that. People like us went to medical school very, late as old people. But I'm a doctor today. I achieved what I wanted to achieve. So why am I saying this? It's not always going to be easy, but you have to do what you still need to do. If you see what's on the other end, very important. Okay? Dietary advice. You have to embrace your green zone. You see, anywhere you see greens, you go there. Anywhere you see plant-based, go there. So you have to eat balanced food. Balanced food means you are not avoiding any food, but you're eating them at the right quantity. And please try as much as possible to be the person preparing your food. Because if you form the habit of taking stuff from takeaway, there are so many additives they put in there. Sometimes there will be things that will disrupt your hormones. So cook your own food. If you can, grow your own fruits, grow your own vegetables, or if you can, make sure you're using the organic one, because when you know what is going into your body, you can control it. So avoid all this takeaway, avoid all this ice cream, this pizza, this cake, and all that. Avoid them. Prepare your own meal. But whatever you eat, then exercise. Okay? All right. Can a woman that have hormone imbalance get pregnant? We need to correct that hormone imbalance. Hormone imbalance simply means the hormones that will help you to become pregnant are not within the normal range. Let me give you an example. When you have high prolactin level, it's a type of hormone imbalance. Why? Because when your prolactin level is high, you will not ovulate. And when you don't ovulate, you cannot become pregnant. Thankfully, when you have high prolactin level, there are some drugs we can give you to bring it down. When you have low progesterone, your body cannot retain pregnancy because progesterone is pregnancy maintaining hormone. So any hormone outside the range, higher, lower, we want to bring it back to normal. So if you have hormone imbalance, and if we don't correct that, becoming pregnant will be difficult. So you need a fertility specialist. Okay? All right. Your time is 1:30 midnight. Okay. Now you know YouTube time. So yes, my time on Tuesdays is 11 p.m. Nigerian time. 6 p.m. Eastern time. So I don't know where you're located. Tuesdays is a little bit late, but weekends on Saturdays are coming a little bit early. Okay? All right. You're 38, you've never been pregnant. What before? Okay, so here's the deal. You're 38, you've never been pregnant. Can you still become pregnant? Yes. What do you need? You need to deal with your reality. You are 38. You are getting to that point when things can easily go south. So you need a fertility specialist. We need to know why you are not able to achieve pregnancy. We need to look at you, we need to look at your partner, and we need to look at the best management for you. So don't throw a pity party. Don't go about telling people, okay, I'm 38, I'm not pregnant, what can you do for me? Then by next year, you're 39, you haven't done anything, and before you know, you're 40, you still haven't done anything. Pity is not going to get you pregnant. Crying is not going to get you pregnant. What will get you pregnant is action. You need to act. So my sister at 38, do something different, do something radical. In the month of May, say, you know what, I'm done, I'm tired. Get a fertility specialist. Go for your preconception visit. Let's know what the problem is. Okay, good evening. Can a woman go into menopause in her late 30s? Yes. Some women can go into premature ovarian failure or premature ovarian insufficiency. That means before 40, your ovary have packed up. So it can happen. If you haven't seen your period, listen to me carefully. If previously you normally see your period, then suddenly you haven't seen your period for 3 months and you have checked and you're not pregnant, red flag, begin to seek help immediately. If you are below 30 or below 40, and you have not seen your period for 12 months, there is a danger. Possibility you've gone into early menopause is very high. So when you notice something abnormal in your body as a woman, don't sit back and start asking OKK or OKAFO. Go to a gynecologist. The earlier we diagnose the problem you're having, the better for you. Don't sit back and begin to ask the doctor. Take this out. Go here, go there. The more you're taking all those steps and going there and going here, the more you're losing your opportunity. So we don't have time to lose our opportunity. You have to do the right things by going and making sure that the doctor is following you up. Okay? All right. Now, there is nothing like 0.3 low hormonal balance. We need to know the specific hormone. There are a couple of reproductive hormones you should be conversant with. Estrogen, progesterone, FSH, LH, prolactin, and thyroid hormones. Avoid the mistake of taking your lab numbers and seeking for opinion from doctors that know nothing about you. They are not going to help you. They will make it worse. If I send you to the lab, take those lab results back to me. Let me review that. If I didn't send you to the lab, don't send me those lab reports because I might be confusing you. Your provider might be giving you a different treatment than if you seek my own opinion. If I'm not a good doctor, I will tell you to do things that might not help you. And you might think I'm helping you, but I'm not helping you. Okay? You just subscribe for 12 months for Believing for Babies. Now, we don't have any such subscription in our group. The maximum subscription in our group is 6 months. Prime. Okay? So better read carefully what you said you subscribe for. Okay? And the best time to actually come in is in May because by June, we are anticipating an upgrade. The fees are going to go up in June. Okay? So guys, thank you so much. I hope I've answered all your questions. Please, let's make it a month of marvelous blessings. Please, please, please make sure you follow my instructions. I can't wait to celebrate your good news. I can't wait to read your testimonies. I can't wait to see your babies. Do you know how beautiful your babies are going to be? Have you ever thought how the baby is going to look? Is it going to look like your partner? Or is it going to look like you? Or is it going to look like your sibling? Or is it going to look like your grandmother? Think about that. Let it be something that keeps you up in the night. Okay? But whatever, if every other thing fails, pray to God, keep on playing, keep on practicing. God bless you. Yeah, COO, I understand the group consult. I don't know if it's what this client is talking about, but individual package is 6 months. So if the client is talking about if the client is talking about the group consult, then you can put the client through. So please follow through with my COO and she can put you through. All right, guys. Thank you for coming. Enjoy the rest of your evening. Okay, what to eat to balance your hormone? It's not a mathematical thing. Like I said, you have to eat all food in right quantity. Then exercise, drink your water, avoid stress, sleep. If you can do all this, then you are helping yourself naturally balance your hormone, which you already have. Okay, so that's what you need. All right. Thank you for coming. I appreciate you. My next clinic will be on Saturday. So tune in on Saturday, 12 p.m. Eastern Time. And that should be your 5 p.m. Nigerian time. Okay, so I'll see you guys on Saturday. Until I see you, take care of you, and God bless you, and bye-bye for now.